Hello everyone. In this video, we will be talking about the chronic kidney disease, or also called as the CKD and CRF, chronic renal failure. As we all know that the main function of the kidneys in our body is to excrete the waste materials from the blood and to purify the blood. But when there is some sort of disease process in the kidneys or the kidneys suffer some sort of damage, this excretory function of the kidneys is disrupted. The chronic kidney disease is a damage to the kidneys which results in decreased glomerular filtration rate or GFR, which lasts for 3 or more months. There is a gradual loss of kidney function in CKD. The changes that occur in CKD are usually irreversible, which makes it more problematic for the patient. The causes of CKD include the first and the most important and major cause of CKD is the diabetes, because the prolonged uncontrolled levels of glucose in our blood lead to the destruction and the damage to the walls of the blood vessels, which impair the blood flow to the kidneys. The second most important and leading cause of the CKD is the hypertension. It also damages the walls of the blood vessels, which also impair the blood flow to the kidneys. The next is the family history. If a person has a family history of kidney disease, he is at increased risk of getting this. The others include the pyelonephrites, glomerulonephrites. Now moving towards the pathophysiology. First, there are some causes that cause the chronic kidney disease, including uncontrolled hypertension, diabetes, pyelonephritis. This leads to the destruction and reduction in the number of functional nephrons in the kidneys. The nephrons are the functional units of the kidneys, and when these nephrons are damaged or their number increases, the functions of the kidney get impaired. First, there is inability of the kidneys to excrete the nitrogenous wastes, which leads to the increased levels of urea and creatinine in the blood. Urea is the waste product of the protein catabolism, and the creatinine is the waste product of the normal muscle breakdown that occurs in our body. Also, due to destruction of the functional nephrons, there is reduced erythropoietin secretion. Erythropoietin is the hormone which signals the bone marrow for the production of the RBCs. But when there is a reduced erythropoietin secretion, there is also reduced RBC production, and the ultimate result is the anemia. Also, due to destruction of functional nephrons, there is inability of kidneys to excrete phosphate. Now, the phosphate and the calcium are having a reciprocal relation in our body. That is, if the level of one increases, the level of the other decreases. And in CKD, the phosphate level increases because this is not excreted normally from the body, and resultant factor is that the calcium level in the blood and overall in our body gets decreased, which leads to the demineralization of the bones, also called as the renal osteodystrophy. Also, there is inability of the kidneys to concentrate urine and inability to excrete sodium and water. Now, this results in more and more retention of the salt and water in our body, which ultimately results in fluid overload and edema. Edema is the abnormal accumulation of the fluid and water in our soft tissues and interstitial spaces. Also, there is inability to excrete hydrogen ions in urine and diminished secretion of the bicarbonate ion. Now, this function is very important to maintain an electrolyte and acid-base balance in our blood. Due to the disruption of this function, there is metabolic acidosis. Now, the clinical manifestations. The first clinical manifestation in CKD is the increased blood urea and serum creatinine, which because these waste products are not normally excreted in CKD, they accumulate in our body, and there is increased levels of these in the blood. There is also electrolyte imbalance, and due to the salt and water retention, there is weight gain, which may result also result in the breathing difficulty. Due to the more and more water retention, the pressure inside the capillaries gets increased, and due to this increased pressure, the fluid moves out of the capillaries into the interstitial tissues, which ultimately results in edema. Also, due to the increased levels of nitrogenous wastes in our body, these nitrogenous wastes get deposited in the skin and result in pruritus, which is the itching. Now, the stages of CKD. The stages of CKD are based on the GFR, that is the glomerular filtration rate. The normal GFR in our body is 90 to 125 ml per minute per 1.73 square meters. There are five stages of CKD from stage 1 to stage 5. In the first stage, the GFR is equal to or more than the 90 ml per minute per 1.73 square meters. There is very little damage to the kidneys, and the GFR in this stage may be normal or may be increased. But in this stage 2, there is the slight reduction in the GFR, which ranges from 60 to 89 ml per minute per 1.73 square meters, and there is a very mild decrease in the GFR. In the stage 3, the damage increases gradually, and the GFR ranges from 30 to 59 milliliters per minute per 1.73 square meters. There is moderate decrease in the GFR. Also, in stage 4, the GFR ranges from 15 to 29 milliliter per minute per 1.73 square meters. There is severe decrease in the GFR in stage 4. In stage 5, the GFR is less than 15 milliliter per minute per 1.73 square meters. This stage is also called the ESKD, that is end stage kidney disease, and it's the last stage of the CKD. Now, the diagnosis. How can we diagnose the disease? First, we have to take the history from the patient and do the physical examination. As the CKD is having a trend in the families, that is, the a person having the family history of kidney disease is more likely to get the disease. We have the history taking is very important. The next is the kidney function test, or the KFT. It looks for the levels of waste products in our blood and gives us a clue about the degree of functioning of kidneys. The next is the GFR and creatinine clearance. It also gives us a clue how well the kidneys are functioning. The next is the renal biopsy, in which a small part of the renal tissue is excised, and the histological examination of that tissue is carried out. Now, the medical management. The medical management of the CKD is focused on the underlying cause. The cause which causes the CKD is efforts are put to eliminate that cause and to stop the progression of the disease. Controlling hypertension and hyperglycemia, because these are the most important causes of and the major causes of CKD. We have to control hypertension and hyperglycemia to stop and more damage to the walls of the blood vessels. Controlling symptoms, for example, edema, anemia, fluid and electrolyte imbalance. Edema can be controlled by the administration of the diuretics like the furosemide, and the anemia can be corrected by the administration of the erythropoietin. Fluid and electrolyte imbalance, this can be corrected by the fluid restriction and reduction in the intake of the salt. Reduction in salt and alcohol intake, this is very important to maintain the fluid and electrolyte imbalance, fluid and electrolyte balance in our body. Smoking cessation, because the smoking increases damage to the blood vessels, blood vessel walls, we have to encourage the cessation of smoking. Now, the nursing management. The first nursing diagnosis in CKD is the fluid volume excess related to decreased GFR, decreased urine output, and sodium retention, as evidenced by weight gain, edema, jugular vein distension. As there is impaired blood flow to the kidneys, the GFR gets decreased, which means less blood passes through the kidneys, and the urine output also decreases. Due to the retention of the sodium and water, the fluid volume in our body gets increased and results in weight gain, edema, and jugular vein distension. Inadequate nutrition less than body requirements related to dietary restrictions to reduce nitrogenous waste products, increased metabolic needs, anorexia, and nausea. Because there is some restrictions on the diet to decrease the accumulation of the waste products in our body, and the patient is feeling anorexia and nausea, the patient doesn't consume enough diet, so we have to make a diet plan which suits the patient of the CKD. There is also risk for decreased cardiac output related to fluid overload, fluid shifts, and electrolyte imbalance. Activity intolerance related to fatigue, anemia, retention of waste products as evidenced by dull activity of the patient. Because of the anemia, the oxygen carrying capacity of the blood is decreased, and there is easy fatigue even on a small activity. Deficient knowledge regarding condition, prognosis, and treatment. This is very important. We have to impart knowledge to the patient about the condition that is he's suffering from, and the prognosis of the disease, and the treatment, and the importance of following the dietary regimen and the treatment. Thank you. That was all about the CKD.